So I have for you, how does family history influence the health risks for minority women, and how can they proactively manage these risks?
Thank you. That's a great question. So, family history in general plays a significant part in our overall risk for health and health disorders. That's why when you go to the doctor, a lot of times your doctor will ask you not only your medical history, but that of your family. Then that's primarily for a couple reasons. One is genetics, right? We get our external characteristics from our family. People tell me all day long, you look just like your mama, you look just like your mama. Well, it's genetics, right? So, in addition to getting external characteristics, we also get our risk factors for the development of diseases from our family. That is also inherited. I see somebody with their hand up already.
And that's fine if you do
Okay.
have questions at the end.
Well, thank you for your question in advance. Um, we get our risk for the development of diseases as well. That can also be inherited, but genetics is not the only component. Also, is environment because we share our environment with our family members. A lot of us live with our family. We have same attributes, same lifestyles, same behaviors. So all of those things are also a shared similarity, and that can contribute to our development of risk. For example, this February is Heart Month, National Heart Month. And so the cardiovascular disease, so that's any kind of disorder, high blood pressure, hypertension, heart attack, stroke, blood valve disorder, that something can also be inherited. But other risk factors are involved, so such as smoking. If you smoke and you have a family history of heart disease, then you may want to talk to your doctor about smoking cessation programs. Also, obesity. That's something. If you're not very active, that's something that can also contribute to your risk. And so you want to talk to your provider about ways to reduce your risk factors for the development of those disorders.
Thank you. That's very awesome. Thank you
Thank
so
you.
much for that. What are some essential preventative health care measures that women should prioritize? What should we take very serious when it comes to minority women and just our overall health?
Regarding overall health with minority women, for sure, definitely preventative care. Um, Getting your regular annual doctor's appointment. They're going to check your blood pressure, your glucose, cholesterol, go over your family history and see what you would be predisposed to. And then there's different things that your doctor will introduce as you get older, such as mammograms. Those are recommended at 40 and every 2 years. Younger women, pap smears every 3 years. HPV is recommended every 5. So that's very important because we're looking at cervical cancer, which is something that can be passed on from your family member or, like we said, environmental. Um, Another thing is prioritizing a healthy lifestyle, diet, exercise. We come from an area where we eat a lot of fried, grease, oil, bread. So you want to pull that back in moderation, more vegetables and fruits. And also prioritizing your mental health because those things are connected. Mind and body are connected. If your body's feeling bad, it's going to affect your mental. If your mental is feeling not so good, it's going to affect your body. You'll be tired, can't sleep. So if you are having those type of issues, that's something you would want to see a mental health care professional about. And I think that's another thing that we as Black women don't seek out. So I think that's very
Yes,
important.
so important. Thank you so much. I really think that it's important to touch on that because just me being as an example, when I neglect my health, everything else falls
Everything.
apart, you know? So it's so good that we're having this discussion today
Right.
because it's actually raising a awareness for me to take it more serious. I
Right.
can't just always be on the go and just put my health on the back burner.
Yes, it's all
So this is really
interconnected.
good. Yes, very good. How does oral health impact overall well being, particularly for minority women? What health conditions can be caused by poor oral health?
Okay. So I loved your response, and I loved your response because they both fed into what I plan to talk about today, which is amazing. So, for overall health, my two main aspects for overall health for women would be heart disease when it comes to dental and mental health. So you touched on both of those. Y'all both touched on those things, which is amazing. So I would like to say one of the biggest things for oral health is again preventative care and maintaining getting your cleanings every 6 months. Like that's so important. And the reason that's so important, major health wise, is due to the risk for heart disease. So when you have inflammation in your gums, that inflammation process, it's chronic. And usually you'll know if you're trying to floss and you find that there's like blood in your floss or you're sensitive to floss or anything like that, that bleeding is not a sign of healthy gums. That's a sign that there's some type of inflammation process going on, and it's usually not limited only to your gums. It's usually throughout your entire body. There is a connection between that gum disease and heart conditions. So having the gum disease holds a certain type of bacteria that if it stays for long enough, it'll get into your bloodstream. And if you have co-concurrent heart conditions, it can exacerbate those heart conditions. Another thing, diabetes and high blood pressure. So those two things contribute heavily to what we call periodontal disease, which is a gum and bone loss disease of your teeth. So everyone thinks that it's normal as we age and get older to lose our teeth. And I just want to make it very clear that that is not normal. That is not a normal part of aging. It does not have to happen if you get your cleanings every 6 months. If you get your cleanings every 6 months, because when you don't get those cleanings, that plaque holds the bacteria, which eventually eats the bone away from your gums and teeth. The teeth become loose over time, and then they fall out. And so usually that happens, you haven't had cleaning for years and years and years. Again, high blood pressure, that makes the process happen faster. High blood sugar, that the diabetes, it also attacks the fibers that hold your teeth into place. So again, it makes the tooth loss process happen faster. So if you really want to keep your blood pressure under control, keep your blood sugar under control, that will also help your teeth stay under control. Then you visit the dentist every 6 months and let us clean off the things that harbor the bacteria in your mouth so you can prevent some of these things. The next overall thing I like to say for minority women in oral health care is, again, mental health. Like, you don't realize how important your smile is until you can't smile. And then when you can't smile, that affects your mental health. You're not having a good day. You're not smiling at work. You're not going to have the confidence to go apply for the job that you want. You're not going to have the confidence to talk to the people that you want, build those business relationships, build those personal relationships. A smile can take you so far. And that's why I love what I do, honestly, full mouth smile transformation, because people's lives really change from getting a smile. Like, they will go on to, girl, I applied for that thing and I got it. I have went to law school, graduating, moving away to do an internship to New York because they didn't have the confidence to move to New York, but now they can smile. It's a big thing. So taking care of your teeth has, you want it when you get older, you want to still be able to eat also. so, so that's something that I really want to stress to our community is going to the dentist every 6 months is very important for your overall health.
That was awesome. Every 6 months, guys. Did y'all write that down? Every 6 months. So important. I'm making sure I put it on my calendar too in my phone so we
No,
don't
and
forget.
a point.
So-
If you have insurance through your employer, or if you have Medicaid, those cleanings are covered 100%.
it is. Yeah.
Your first appointment, if you have insurance through your employer, your first appointment, which is exam, x-rays, consultation, that's covered 100%. percent If you need a simple cleaning, that's 100%. So every 6 months, you get your cleanings for free. Your employer knows how important this is. That's why they give you dental insurance and health insurance. They don't only give you dental. They only give you medical. You get dental for a reason, because you'll call out of work if you have a toothache. If you've had one, So they give that to you so you can take advantage of it. It's completely covered. Even if you have Medicaid, if you can find a provider that accepts Medicaid, those cleanings are covered.
Perfect. Thank you so much for that. So, Dr. Charles, how can pharmacists help empower women to take control of their medication management and overall health outcomes? Because I know this is very important right here.
Yes, yes, very important. So, one, I want to mention that pharmacists, you may see us mainly at retail pharmacies, CVS, Walgreens, but we are in a variety of different places. We're in clinics, we're in hospitals, we work with the federal government, we're in academia, and in the clinic setting, and even in some pharmacy settings, we do what's called medication therapy management. And so we'll bring you in and we'll look at all the medications that you're currently taking, prescribed medications, over the
counter medications, because over the counter medications get overlooked. When I ask patients what medications they're taking, they'll list all the prescribed ones, but then never mention the over the counter ones. And those are very important because that's the ones you have easy access to, right? And all of those can lead to drug interactions. So we look at all of your medications and we're looking for any medication related problems. The medications that you're taking, is there any duplicate therapies on there? There may be some things, sometimes we see different providers and they don't all talk to each other, right? Or sometimes you don't get a chance in your doctor's appointment or your provider's appointment to say what the other provider did. That's why I'm a big advocate for integrated healthcare models, care under one roof, so all your providers can see what the other providers did for you. So you essentially have to be your own historian a lot of times when you go into these doctor's offices. But we're there because we're typically the ones seeing all your different medications come through. So we can serve as that liaison with your providers to let them know what was started, what was stopped, what was increased, what was decreased. And that's important for you to know too, because as I tell patients, you are the ultimate person that is there to take care of your health. I can help you, but I can't be there all the time, right? So you need to know, when was something recently changed, and when something was recently changed, did you notice any symptoms? Also, when you started a new medication, we can educate you and let you know, when is that timetable for when you likely will see a therapeutic effect or when it will likely work. A lot of times we have patients that will prematurely stop medications because maybe they were never educated on, hey, this medicine may take a few weeks for it to work. Or side effects, what side effects to expect, and if you have side effects, how do you manage them? So a lot of times you may know what the side effects are, but you may not know that there are simple things that you can do on your own, and there's certain times when you should reach out to your provider or for emergency health care. So we educate about that too. We also talk about management at home. So for chronic conditions like high blood pressure, high blood sugar, high cholesterol, I call them the Holy Trinity. We see that a lot in Southwest Louisiana. And a lot of them, they don't present with symptoms all the time. And if they do present with symptoms, usually it's probably too far gone if something is presenting. And that common one is the silent killer, high blood pressure. And so most times I ask patients, when the last time you took your blood pressure? Well, it might have been at the last visit a year ago. So what's been going on over that past year? Or if you actually know you have high blood pressure and you're on medication, how do you know that the medication that you're on has been working if you only see your provider every 3 to 6 months? And so doing things at home, you can help manage and see what's going on with your blood pressure at home, and you'll be able to relay your numbers to your provider. So we do all those things to educate. We're more than just dispensing medications in the pharmacy. We're looking at your medical history too. So we talked about family history and past medical history. Not only do drugs have drug interactions, but drugs can interfere or interact with certain disease states. So that's very important as well. Some drugs are not indicated if you have a history of a certain disease state. Also, there are drug age issues. So for our Jerry's, our elderly population, there's a whole list called the Beers criteria that they publish, and it says which medications should we likely take caution in prescribing in that older population because they're more prone to having certain drug side effects. As we age, our bodies change, and so we may not be able to metabolize or be able to tolerate certain medications like we did when we were younger. And then lastly, as far as preventative care, I am a huge component of preventative care. I just got my teeth cleaning last month, so I'm a big thing of that. But preventative care, the goal is to always to be proactive and not reactive. By the time you are reactive, it's probably too late, right? It's probably too late. So I really wish as a country we could shift more to preventative care, because we would definitely have a lot of better outcomes. So with pharmacists, we can do rapid test screenings. So testing for HIV, hepatitis C. We can do quick blood sugar checks. We can do blood pressure checks, cholesterol checks. And of course, vaccinations. That is a huge proponent of preventative care, right? Vaccinations have allowed us to extend life. And you can see the difference between countries like us and third world countries where they don't have those vaccinations and what they are dying of and what we're dying of. So we are there for you, not just to give you your medication, but we're looking at ways to help prevent certain things from happening with your medications and to also give you non-medication recommendations as well. So we're not just about the drugs because we realize that drugs are just one component, that it takes non-drug lifestyle measures to get you where you need to be.
Wow, that's such good information. I didn't realize how much y'all do as a pharmacist. So thank you for sharing that with us all
Absolutely.
this morning.
Thank you.
I mean, this evening or whatever. But we're gonna make sure that we're proactive, guys. That's one of the key factors I heard to take that note to be proactive. And if you have questions, utilize your pharmacist and ask those questions. It's okay. Not there's no stupid questions out there. So if you have a question about your medication, please reach out to someone. Your resources are here. That's what we're all here for today, to give you that and to let you know it's okay. Like, we all face different health issues, and if we have a community of people like such that can help, it's a much better lifestyle, a much better way to live. So, with next question, we have with Dr. Romar Chavis. How can chiropractic care benefit women in managing musculoskeletal issues, especially considering potential cultural or socioeconomic barriers to accessing conventional health care? How can you help us break this down?
All right, so that's a great question, and I feel like I'm piggybacking from our last doctor. Um, that there are non-medicine or non-prescription things that we can do, and chiropractic is one of them. Chiropractic is the most effective form of treatment for musculoskeletal issues like your neck pains and your back pains, shoulder pains, and chiropractic means done by hand. So there's no drugs or no surgery. So for those people that want to promote their health in a natural way without prescriptions, you can come to chiropractors. And what we'll do, we use many different ways to gather information about your health. We do a complete health history. We do imaging studies. We'll do palpation with our hands. We'll do orthopedic testing, and we'll just basically see where along your spine there's something wrong and where something is stuck. And we find the area and we just correct that with a simple chiropractic adjustment, which a lot of people seem to be scared of because they haven't experienced it before. And then once they experience it for the first time,
I can speak to you, but okay, I'll just give a comment because I'm a dentist. So every day I'm at work, I'm working with my head down and I'm using my wrist. So I get a lot of upper neck pain and a lot of wrist pain. And one day I woke up and I could not turn my head and my wrist was done. So I had to call into work. I couldn't go. I'm trying to call around, like, what do I do? I don't like taking medicine. So, and I don't, because I can't operate. I still have to think cognitively and be a doctor. So I can't be out on on a medication, on a pain medication. So someone told me, call Dr. Romar Chavis.
yay.
I went and we did 4 weeks. Like, I think we did 4 weeks. So I went once a week for 4 weeks, and my wrist I've never had carpal tunnel issues again. Wow. It's been
It's amazing.
over.
Over a year.
I've never had carpal tunnel. And if you have carpal tunnel, it's terrible. But she has, I think we did ultrasound therapy and the laser treatment. And when they were doing it, I'm like, this is not doing anything. Like, I'm looking, it's just like warm jelly in a red light, and they're doing this. I'm like, this is make believe. Like, what is it? Right. On the first day, it doesn't feel like anything. But after 4 times, wrist never had a problem again. My neck is fine. Like, look, go to the chiropractor. Before you take medication, I always say, like, try a natural route, because with a chiropractor, you can actually fix the root of the problem instead of just patching the symptoms with medication. And it truly works. It really, really does. So,
Well, I'm coming
thank you,
next.
Dr.
I'll
J.
be your next.
Hey, I feel like I don't have to say anything else. You can't beat a testimonial. Right. Right. So y'all have heard from a patient of mine. But y'all, prevention also, what she spoke about is very important. Loving yourself enough to check to see what is going on with me. And I find that a lot of my patients, once they started getting adjusted, like you're in tune with your body. You know when something is off. You know, so once you feel something is off, then we can check to see. And although I don't use drugs or surgery, I can make the proper referrals to other doctors that may be able to help you beyond something that's beyond the scope, because chiropractic doesn't help everything. But whenever we trace every problem back to the spine, everyone in here has a spine, right? Everyone in here has a nervous system, right? So everyone in here is a candidate for chiropractic care, because even though most people come for pain or back pain or they got in an accident, we really are working on helping your nervous system function better. And your nervous system controls every aspect of your human existence. So getting your spine checked is very important, especially since this is about women, mothers that are pregnant. It is like number one important to see a chiropractor during their pregnancy, because your body is changing in ways that, it's literally structurally changing. Your ligaments are not the same ligaments you used to have before you were pregnant. And things can shift and change. And getting these addressed by a chiropractor, like, will make your pregnancy go so much smoother. And all those pains, it'll help correct some of the imbalances that can cause those pains. I've even seen mothers that had babies in breech position after getting adjusted, and we work on some of the ligaments in the pelvis. Um, those babies have turned into the normal position just with chiropractic care, and this means it'll save you from potentially having surgery. So chiropractic is very important for women, for mothers, even for the babies. I've adjusted infants as well, and y'all, like, the differences we can see with just our hands is very mind blowing. And also, one other thing, I don't know how much time I've been talking, but I can talk all day. People that suffer with headaches a lot, especially a lot of women have migraines. That's a female predominant condition. I've seen people with migraines that have had headaches pretty much their whole entire lives. After coming getting adjustments, maybe, I don't know, 4 to 6 adjustments, and then they're migraine free. So that's just something, a natural form of treatment for things that's a female predominant condition that can be helped with chiropractic care. And I feel like I wanted to say one more thing. Oh, yes, we do also use physiotherapies to manage your care as well. Like Dr. Simeon said, we use things like cold laser therapy. We use things like ultrasound, heat. We have different techniques that, especially for your joints along your arms and your legs, like your knees, your shoulders. We have all those techniques to benefit those areas, as well as the chiropractic adjustments to your spine. And we also adjust your joints as well. So just helping with your mobility and help keep you in proper alignment really does help your whole nervous system, which controls everything, to help your body to function better without drugs or surgery.
Wow. Thank you so much, Dr. Chavis. I appreciate all of that. What are some culturally appropriate dietary recommendations that can promote optimal health and wellness for women?
Gotcha. So you've already heard someone say, eat more fruits and vegetables, diet changes are important to your overall health. Who in the room has heard of My Plate? Quite a few. Okay, I won't go into all the details, but it's, mainly make half your plate fruits and vegetables, eat whole grains, vary your proteins, and have a dairy component. The USDA formed this initiative to take place of what is formerly known as the Food Guide Pyramid. It is an outline of what our plates should look like at every meal so that we are getting the most nutrients possible throughout the day. However, I want to touch on that dairy group for a second. I have a hate relationship with cow's milk. Um, but I do want to give some information to back up why I feel that way. It's not just my personal preference, it is science behind it. Um, 80% of African Americans are lactose intolerant. So this is meaning that cow's milk is not for you. You do not moo. Cow's milk is made for baby cows. um, there are alternatives out there that are just as nutritious and provide the same nutrients as cow's milk. I want to say that cow's milk has a tendency, for those who are lactose intolerant, has a tendency to show up in signs of, bloating, whole body inflammation. This can make you feel sluggish. You have digestive tract issues. This can be gas. This can be constipation. It can even be diarrhea on the reverse end. You don't have to suffer through it. There are other options available to you. So just because they say dairy, they're not necessarily meaning it has to be in the form of cow's milk. This can be coconut milk, almond milk. This can be rice milk, oat milk, whatever suits your fancy. There are other options out there, as long as you are incorporating it at every meal. I'm not going to even lie to you. The cheese does not taste like cow's cheese. However, they are getting better with as technology progresses, and they're finding new alternatives to produce these replacements for it. They do taste a little bit better. One thing that is not mentioned in the My Plate diagram is water. Water is a big component of what you need to be consuming on a daily basis in order for survival. Every cell in your body requires hydration. Every cell in your body requires hydration. From the hair that's growing out of your scalp to the toenails growing out of your feet, every component of your body needs fluid. Now, there used to be recommendation growing up. I was always told, oh, eight glasses of water every day is how much you should need. Actually, that's incorrect. Each person is individual. Their needs are different. And these days, the CDC is actually recommending that you do half of your body weight in ounces. That's how much fluid you should intake in a day. So a 200-pound person, half of your body weight is 100. That's 100 ounces of fluid you should be intaking every single day. This is equivalent to 12 and a half cups, more than those 8 cups that was recommended. If you are an athlete, of course, you're going to require more fluid intake because your body is perspiring constantly during your workouts, meaning you have to replace what's lost. Also, I'm sorry. Okay. I'm not telling you, oh girl, you got to go out and you got to drink over a gallon of water every single day. That's not what I'm saying. You can also eat your water. It does not have to be in the form of H2O as we know it coming out of faucet in a bottled water. This can be consuming teas, coffee. This can be also consuming high water content foods like melons, cucumber, berries, spinach. Those sorts of things have a high water content, and it will be beneficial for you to consume more of those in your day-to-day.
Wow, thank you. Awesome. Got me thinking about what I need to put in my refrigerator. But I love what you said about cow's milk, and I have changed and I've noticed a difference within my own health. So, hi, Dr. Davis. So, what are some key factors that contribute to disparities in breast cancer outcomes amongst minority women, and how can we work to address these disparities?
Okay, so I'm sure everyone in here knows at least one woman or has one family member that has gone through breast cancer. Okay, so in this area, um, we've seen a big journey from where we were years ago with the improvements in care. Some of the biggest factors that affect breast care treatment and prevention are amongst women, socioeconomic status. Genetics plays a huge role in that, and There are a couple of other factors like diet, but one of the things that we don't consider, especially among African American women who have had family members who may have had unsuccessful outcomes, is fear. And fear sometimes stops us from getting the prevention that we need. So I know there's still some limited access in rural areas, but whether you have insurance or you have Medicaid, there are resources available to make sure that preventatively you can take steps to ensure that you have positive outcomes with regard to breast cancer prevention. I have been considered high risk since the age of 35 because of the prevalence of breast cancer in my family. I have two aunts on my dad's side, three aunts on my mom's side, and a total of like 10 first cousins who've been diagnosed with breast cancer. And so at 35, I remember going into my doctor's office and saying, I need to start having mammograms this year. And he says, oh, no, you don't. He says, you're still young and research doesn't truly support that. And your breast tissue is still dense. So even if you had something, they wouldn't be able to see it. And I immediately realized that that wasn't the physician for me, and I never returned.
Smart. Good for you.
I transferred to a doctor who looks like me and who would listen to me and who never brushed off my concerns as me overreacting. And I immediately was referred to a high risk specialist. And we have those here in town for you too. Dr. Shonda Grisby is a breast surgeon who works with Oshner Medical Group, and she actually has a practice to where even though she does breast surgeries, she has nurse practitioners in the office. And I was immediately put on a routine regimen of having a mammogram in 6 months and followed by an MRI 6 months later. And I've been doing that since I was 35. In October, doing the regular MRI, something finally came up. And I was like, wait, hold on. I just was here in February. Where did this come from? And that's what she explained to me. She was like, that's part of prevention. It wasn't there before. So now we have a timeline. And then there was a biopsy. And the biopsy showed that it was benign. But because of it being rare and the potential for it being cancerous, she took it out. And so from October to December, I was just a wreck. I'd had genetic testing done over the summer, so according to the genetic testing, it didn't say that I had any mutations. So in my mind, I'm like, phew, all right, I'll never get it. On with life. And then this happens in October. Had I remained in a place of fear, I could be dealing with something in my body that shows no signs, no symptoms, but yet could be detrimental to my livelihood and my health. So while there are many factors that can lead to an increase in breast cancer, regardless of those factors, we can take steps to be active in our medical care as well as seek out preventative care to ensure that if something comes up, your doctor can stay on top of it and catch it early. So I encourage all of you to seek out care and at least get your baseline numbers. I'm young 40s and I have 5 specialists, and I just went to the family practice doctor this week for my annual checkup, and he's like, I don't think there's anything for me to do. And I'm like, right, because I'm managing my own care. If you don't want to see me, somebody else will see me. I call and get my own referrals. I tell them fax the order to my doctor. And I have a conversation with my physicians if it's somebody I'm seeing for the first time. And I tell them, research shows that as an African American, I may not be heard and my voice may not be heard. Are you willing to respect my voice? Are you going to listen to me? Are you going to respect my wishes? And then I can determine if I choose to support you in your business. If not, out the door, find somebody who will. And so the key factors, like I said, are all around us. We've talked about them. Diet and exercise, genetics, the foods we're eating, the socioeconomic status, the places we live, and the things we're exposed to in our environment. But more important than those factors are the steps that we can actively take for prevention. So don't let fear hold you back. Don't let, the thought that I'm okay and I don't need the help. Get your baseline numbers done, and then that way you're giving your physician something to work with. See your doctors regularly. So if comes up, it can be identified. And take care of yourself. Mind, body, and spirit. They all work together to ensure that you are healthy and well and flourishing in life.
Thank you so much. Now we're going to open up the floor. If any one of you have questions, I will open up the floor for at least 3 questions. So first we have the young lady right here.
Unfortunately, oh, this is loud. Unfortunately, we're not all that. It sounds really nice and easy, advocate for yourself and things like that, but it's not that easy. And we bring our kids to the doctors, and the doctors say, oh, you got to drink that dairy milk. You got to give them that dairy milk. The other stuff is just, not real, do this or you go, and there are not that many specialists, and especially not that take Medicaid. So, that's another problem. Like, for example, dentist, I stopped by your table. I said, hey, you guys take Medicaid? Nope, private insurance. So there we go again, there's just these community clinics here in Lafayette, to go to. And then even some of them, like SWLA, they mentioned, well, you can get your x-rays for free, but then guess what? You have to have your big cleaning, not just that little cleaning and everybody, and then it's based on income, and you do have to pay for that. So some of us don't always go the 6 months, and then we have those cavities and other things, and yeah, so.
Do you have a question? So your question for, oh, okay, I'm sorry.
I understand your situation completely. I'm so proud to say that on December 31st, I received a letter telling me that by Medicaid standards, I didn't qualify for it anymore. My kids didn't qualify for it anymore. But for the last 21 years, my children have been on Medicaid. I had every child that my 21, my 16-year-old, and my 14-year-old, I was on Medicaid. And just because there's limited access, sometimes you have to find that information for yourself. I'll give you an example of the dental care. My son has some sensory processing issues, and he couldn't go to a regular dentist because they couldn't put him to sleep or give him any medicine when they were doing work. They ended up sending us to a doctor in New Orleans who paddleboarded my child and tied him down to fix his teeth. And after I heard the experience he had in the back, I said, we have other options. And so there are a few dentists local who will take Medicaid for the children. I'll be more than happy to share that information with you offline. The doctor who told me, yes, right, right. I'll give you the name. And then, the same thing with regard to the preventative care. The doctor who told me no was a Medicaid doctor 13 years ago. But that didn't stop my desire. I've done a lot of research, and sometimes when you will call those 800 numbers, they'll tell you providers who are in the area. Sometimes I may have had to wait on a wait list, but the community clinic on Surrey, they were able to pull the teeth and be able to give my children some type of medicine when that had to happen. And so sometimes it comes with an awareness of those places, and we have a lot of resources here, and sometimes if we don't do it, we'll be able to give you people who can do it. And another thing I've had to do over the years is do my own research, and so I may not be able to have milk, but I've started juicing to make sure that my body has the nutrients I need. I don't buy myself much, but I sacrificed and bought a juicer, and so I'll find recipes online to naturally combat inflammation and those types of things. And so while all of the resources aren't at our hands and our fingertips, sometimes we have to press and continue to ask and continue to find those places because they may be a little harder to find, but we do have them here in the community. And just because you're on Medicaid does not mean that you're locked out of quality health care. You just have to find the places and find the relationships and continue to push forward in doing that research. So I'll be more than happy to share those names with you afterwards.
Thank you so much. Does anyone else?
I just want to share for dental resources, places that accept Medicaid, if you guys are looking for any places. For anyone 20 years and younger, there's Taylor Dental on Evangeline Thruway. What's next? Next to City Trends. They accept Medicaid for anyone 20 years and younger. For the adults, if you have dental Medicaid, again, there's the clinic on Surrey. I believe it's called Iberia Comprehensive on Surrey Street. They accept Medicaid. If you have children that maybe have sensory processing issues like yours, there's only so many options you can do for the little kids because they won't stay still.
Right.
So if they can't stay, we can't put a drill while our kid is like, like we can't do, you'll hurt them. So we do have forms to like wrap them in a little blanket, but if you're uncomfortable with that, they can also be sedated, but sedation has to happen in the hospital. There's only certain days available for that. There is a dental office in, like, because we're limited on the days, but I do know there's a doctor in Youngsville. Her office is Acadiana Pediatric Dentistry. She's a female doctor. She does accept Medicaid, and she does do sedation. If you don't want to have your child strapped in the papoose board, that is an option.
Thank you. Thank you so much. Well, I just want to say thank you all for those amazing responses.